everybody, it's Amanda from the PB team bringing you our weekly Instagram live. So today we're going to be having a talk about Acne 101, so kind of everything that you need to know about acne as it's Acne Awareness Month. But just before we kind of get into that, I just wanted to let you know that today's live is sponsored by Timely Appointment Software. Now Timely have sponsored all of our education this week, helping PB to deliver webinars and lives for you guys so you can upskill during this time of closure. And I'll be putting a little bit more detail about Timely's Consult by Timely app in the comment box at the end and when we post this to the grid, so just keep an eye on that. But thank you for everybody who's joined so far. Just let a couple more people in before we bring in Andy. So Andy is an esthetician and a facialist, and he's going to be talking about all things to do with acne, and I know a lot of people are really excited about that. Hello everybody who's joined, thank you for joining today, hope you're all well. Hi, let us know where you're watching from and how you're doing, love to hear from you guys. So yeah, I'm just going to bring Andy in. Oh, thank you so much, Iga. I'm desperate to go to the hairdressers, you wouldn't believe it. But thank you for that lovely comment. I would just bring Andy in now. Okay, so Andy should be joining us in a minute and then we can talk all things acne. I think this is going to be a really good talk, guys. Loads of stuff to go on. Hi, Andy.
Hi, how are you doing?
I'm good, how are you?
Yeah, I'm good, thank you. Good, thank you.
Thank you so much for joining us today. We really appreciate it. How have you been doing in kind of lockdown and everything? You okay?
Yeah, I've been fine. I've been really busy, really busy. I kind of started doing online consultations literally from day one. So closed the clinic on the Friday, started doing consultations from the Monday, and kind of haven't really stopped since. So that's pretty much what I've been filling my time with: consultations, keeping in contact with clients and customers, and yeah.
Amazing.
Okay.
Yeah, good.
How about yourself?
But thank you for joining us today. So as I was telling everybody, obviously it's Acne Awareness Month, and today we're going to be talking about acne, the different types of acne, and how to treat clients with acne accordingly in salon or spa or clinic. And also a little bit later on we're going to be talking about the issue of clients with blemish prone skin wearing masks, which obviously now are mandatory when you're getting on transport, which could be an issue going forward. But just before we kind of get into it, you know, how important is Acne Awareness Month? You know, and do you think there needs to be more spoken about acne in the media in general?
Absolutely. So speaking from somebody who has also had acne and has suffered for acne for a long time, it's obviously a subject that's very close to my heart. So, and I think acne is, although it's something that everyone knows about, and it's actually the most common skin concern that, you know, it affects up to 85% of the population at some point in their life. So, but although it's very well known what, you know, the symptoms of acne, i.e. how it presents itself, I still think a lot of people actually don't understand the condition well enough. So the more education that we can put out there about, you know, what acne is, how it actually comes about in the first place, and also how to treat it successfully. Oh, there we go. I think
sorry, a little bit of a delay there.
So yeah, the more awareness, the better, as far as I'm concerned.
Definitely. And obviously there's different types of acne as well. Are you okay to just talk us through the different types and the things that therapists and estheticians should be aware of when they're treating these different types?
Yeah, absolutely. I think before we jump into the different types of acne, I think it's worth just clarifying actually what is acne, because as I was saying, I think a lot of people are aware of visually what acne looks like, but actually in terms of what it is as a condition. You know, if you ask most people what is acne, they'll probably refer to the spots. But because the spots are the physical symptom that we see happening on the surface of the skin, but actually, if we categorise what acne is, it's a multifaceted condition, and it's an inflammatory disorder of the follicle, the pilosebaceous unit, and also the follicle itself. So before the spot gets there, there's a lot that's going on, or you know, going on within the skin actually before the spots even start to appear. So I think that's, and the reason that's important is because when it comes to a treatment, from a treatment perspective, if we think of acne as just spots, we will fall into the trap of treating the spots. And I refer to this when I'm speaking to my clients as kind of firefighting. So you've got an active spot, you're treating the active spot, but you're not necessarily taking into consideration what may be going on underneath, what's happening, what's gone wrong with that skin to get to that spot. So I think that's always really important to keep in mind. And then in terms of the different types of acne, so we tend to categorize acne in grades. So grades 1 to 5. And basically the main difference is the severity. So the higher up the number, the more severe the acne. We've also got the differences again between adolescent acne, so i.e. teenage puberty type acne, and your more hormonally mediated adult acnes. There are then different types of acne. There's like acne mechanica, for example, which is like more of a friction type acne. A condition called acne congobola, which is specifically for the back. So there's a wide variety of different types of acne, and in terms of how they're addressed, it may vary depending on the severity, the grade, and whether it falls into this category of what we refer to as non-inflammatory acne or inflammatory acne.
Right, yeah.
So non-inflammatory, for example, would be your grades 1 and 2, whereas inflammatory acne would be your grades 3, 4 and 5. So from a treatment perspective, I would always treat grades 3, 3, and technically 4 and 5 should always be referred to a medic for medical treatment. Having said that, it's not that we can't treat, grades 4. I have treated clients that are grade 4 acne, but we should always be referring. So our treatments are complementary to medical treatment as well. But in terms of non-inflammatory acne, so grades 1 and 2, they may respond very well to topical skincare, things like chemical peels, for example, possibly. Whereas your grades sort of 3 and 4, where it's more inflammatory, again, skincare and home care really underpins that. But it may be that we start off with something energy-based, things like LED light therapy or maybe like laser therapies, just to bring that inflammation down and support the skin before, jumping in with any sort of like peels and things.
Yeah. Are there any treatments that can really exacerbate the issue and that therapists should really steer clear of?
Again, it can vary depending on the client and why the acne is presenting itself in the first place. And again, this kind of comes back to what I was saying at the beginning. Unless we have more of an understanding about what the acne, what acne actually is and how it presented itself in the first place, and that all comes back to consultation. That's where consultation is key for me. Before I even lay my hands on client, I will spend at least a good hour in consultation with them, trying to piece together, I call it trying to piece together like the inflammatory load, making the inflammation connection. So it's trying to find out what is it within that client's medical history, lifestyle factors, dietary factors, as well as what they're using on the top surface of their skin that could be contributing to the health of the skin and also preventing, the issue from clearing up. So consultation is key. And then, because there might be some skins that you initially look at it and think, oh, maybe a course of peels would really benefit that skin. But then actually on closer inspection, when you talk to them a little bit about what they're using on their skin, how their skin responds to certain ingredients in home care, that actually peels in that case could make it a lot worse. And that unfortunately that has happened to me in the past, particularly, earlier on in my career when I was kind of still learning. So yeah, you can absolutely exacerbate the condition if you are not careful. Fundamentally, acne is a skin barrier disorder. So if we are not careful and we overuse things like peels or exfoliating treatments, when that skin barrier is already compromised, that's not going to clear that up. That's just going to make it worse. So yeah, that's where consultation for me is key, because you need to understand the skin history before you start putting a plan together.
And obviously with acne, genetics plays one part in it, but how much does lifestyle factors play in how severe the condition can be, especially stress as well?
Yeah, stress is a huge factor, especially with your grades sort of 3 and 4, where it's more hormonally mediated. I mean, one important kind of point to make actually is that we tend to refer to, we'll all have clients that will come to us and say, oh, I think my acne is hormonal because of where it is on their face. But actually, there's a hormonal element to every grade of acne, even the grade 1, where it's just comedones. It's all to do with your androgen hormones, and whether it's the amount of androgen that's being produced or the sensitivity to it. So there's always going to be a hormonal element to that as well. But yeah, in terms of like stress, especially when it comes to those hormonally mediated acnes, I mean, if you think about what's happening to the body when we're stressed, adrenal glands are pumping out a group of steroid hormones called catecholamines. So they'll include epinephrine, norepinephrine, cortisol, etc. And they're all shown to exacerbate acne. If you have acne, those steroid hormones will make the symptoms a lot worse. When we stress, our immune system's suppressed as well. So again, our healing capacity is always impaired there. As well as we tend to make bad dietary choices as well when we stress.
I was going to ask about diet, how much that plays into it.
I'm a big believer that diet is a huge role in acne. It becomes a little bit of a controversial topic because of the studies that are out there are sometimes a little bit conflicting, and also there's often a lack of data in connection between diet and acne. So one example, for example, people will always come back to the whole dairy and acne connection. Is in some cases it is, in some cases it isn't. Sugar is a huge one as well. So sugar, I would say, is even more of a problem than what dairy is. So if we're eating off diet, our insulin levels are being constantly triggered, up and down throughout the day, and that insulin has the same response on the skin as what the androgen hormones do. So you get increased production, increase in cell turnover. So sugar absolutely plays a role. But if we think sort of outside the box as well, there's such a strong correlation between gut health and our skin. So there's the gut and skin axis. There's even the gut-mind-skin axis. So, and what we're consuming on a daily basis affects our gut health. It affects our gut microbiome. So I think it would be a little bit short-sighted for us to say that diet doesn't affect our skin, because we know that diet affects our microbiome, our gut health, and we know that our gut health affects the skin. So therefore, of course, there's a connection. So I think one of the things people fall into the trap, and again, speaking from personal experience, I did this with my own acne, we tend to very much focus on foods that we should be eliminating and avoiding. But actually, we also need to ensure that we're not being deficient in anything as well. So key nutrients, particularly from a skin health perspective, things like our omegas 3 and 6, so our essential fatty acids, very important for the quality of the sebum that's coming through the skin, the ceramide production within the skin, with lipid barrier. So it all plays a role. So good fats are really important, as well as trying to avoid the sugar and the dairy as well.
Yeah, and it was interesting earlier when you said that sometimes people try to treat acne and they're just trying to put out the fire rather than looking at overall skin health. And I think one of the really hard things with treating acne on clients is not so much treating the spots, but also the scarring and the pigmentation that is left behind afterwards. What would be your advice on how to treat acne scarring and acne pigmentation?
Yeah, so again, it will depend on their skin type, what kind of blemish is left behind after the acne is cleared up. So for somebody of our skin tone, for example, we're more likely to get something called PIE, or post-inflammatory erythema. Those are the red marks that are left behind from acne. Again, somebody with a darker skin tone, so brown and black skin, they're more likely to get PIH, or post-inflammatory hyperpigmentation. So those are the brown marks. So the treatment approach for those will be slightly different. It may be, obviously in the PIH and the pigmentation, we need to incorporate ingredients that are pigment brightening. Whereas in the PIE, the red marks, we need to include ingredients that are more anti-inflammatory and can kind of reduce the inflammation there. And then in terms of atrophic scarring, so this is where obviously there's damage. There's damage, and then there's scarring. So there's scarring, to the dermal layer of the skin, and the skin's kind of collapsed in on itself.
Yeah.
Then we'd be looking at more regenerative treatments to help rebuild that scaffolding. So for me, microneedling, I use a device called Skin Pen Precision in my huge fan. So microneedling is great for kind of scar revision. Yeah.
And just before we kind of carry on with my questions, and there was just a question that came up a little bit earlier that I just wanted to check, which came from Veg Owl, and they were just asking whether skincare can make a difference when it comes to hormonal acne.
Yes, it can. So we obviously can't control our hormones. There's nothing topically that we're going to put onto our skin that will affect our endocrine system. But what we can do is there's a group of ingredients that are classed as 5-alpha reductase inhibitors. So androgen hormones, i.e. testosterone, gets converted into a substance called dihydrotestosterone within the cell. But there's an enzyme that's involved in that conversion called 5-alpha reductase. So if we can use an ingredient to inhibit that conversion from testosterone to dihydrotestosterone, or DHT, we can therefore alleviate that hormonal lesion from appearing in the first place. So I like to use a group. I combine sort of 3 ingredients together when I'm dealing with my clients: azelaic acid, zinc sulfate, and vitamin B6. So by using those 3 together in conjunction, you can get, there was a study I've done about 2 or 3 years ago to show that in low levels, in a liposomal encapsulation, that you can reduce or inhibit the 5-alpha reductase enzyme by about 90%.
Wow.
So yeah, you can get a really good improvement. So yeah, we can't control our hormones, but we can sort of inhibit that conversion topically.
Thanks, Andy. And guys, do post your messages in any questions for Andy, because we will get him to answer them all at the end. But great question, because that was actually something that was on our list. So thanks, Veg. Also, I just wanted to ask you how you're helping your acne clients at the moment who are suffering. Obviously, they're in lockdown. They can't see you in clinic for their usual treatments. How are you helping them manage the condition until they can see you again?
Yeah, so as I said, since the start of lockdown, literally from day one, I've been doing client consultations, not just with new clients, but keeping in contact with my existing clients, you know, for those that need a little bit more hand-holding. Unfortunately, prior to lockdown, you know, kind of was halfway through courses of treatment with some clients. So that obviously had to be put on hold. So it has been, you know, a lot of hand-holding over Zoom, lots of consultations, ensuring that they've been supplied with products. So I've been kind of shipping product out to them on a regular basis, and just kind of adapting their treatment protocol in terms of their home care in response to how their skin's been behaving in lockdown as well. I mean, it's obviously been a very, very stressful time and unsettling time for a lot of people. So the types of acne that we've been seeing, even in what I'd say grades 1 and 2 type clients, have been seeing slightly different changes in their skin because of the impact on the stress. So again, we've had to maybe tweak their home care in response to that, take a little bit more of a nurturing approach rather than a typical sort of treating an adolescent type acne, for example.
Sorry, I was just going to say, have you found that any of your clients have been suffering with more breakouts than usual while they're in lockdown? Because we've heard a lot from different therapists where, especially around the chin and the jaw area in particular, that people are breaking out. And would you be able to explain a little bit more about why that's happening?
Yeah, absolutely. I definitely saw it within the first couple of weeks of lockdown, and I saw it in my own skin as well. My skin definitely had a bit of a wobble the first couple of weeks because, as I said, we've never been through anything like this in our lifetime before, and I'm hoping we never have to do it again. So it's a very unsettling time for everyone. Nobody quite knew, you know, what was going on, and it's obviously very stressful for people. People are losing jobs, unfortunately. You know, it's a very unsettling time. So, of course, as I was saying previously, that impact on stress and the catecholamine hormones, the group of steroid hormones, are going to have an impact on the skin. So if you're already an acne sufferer, particularly the area that you mentioned, this is classic hormonally mediated area, that those increase of steroid hormones are going to have a negative impact on the, on the skin, as well as the digestive system as well. So
yeah, I'm sure probably a lot of people are guilty of snacking on the wrong things during lockdown.
I mean, my alcohol consumption when I
Yeah.
first went, definitely.
Yeah. I have to
So,
say, gin o'clock seems to be all the clock at the moment, doesn't it? And also, I mean, even before kind of lockdown, were you seeing a rise in clients dealing with acne, or having adult acne kind of show itself on the skin when they haven't previously had it before? And if so, why do you think there's been such a rise in the skin condition?
It's interesting. I've always seen quite a lot of acne clients, and I don't know whether that's because of my history with acne and whether people just sort of resonate with me and come and see me about it. I'm not sure, but I've always seen quite a big proportion of acne clients. So I can't say that I've seen like an increase prior to lockdown, but I think one of the reasons why we're seeing an increase in acne overall in general is just, life's hard, life gets stressful. There's so much other things going on. We're living a fast-paced life. Our diet is not always the best. And I think that all contributes to an increase in conditions like acne happening. But yeah, I can't say that I've personally seen an increase. As I said, I've kind of always had a big acne client base.
Yeah.
Yeah.
Well, because your skin looks amazing now, so I'm imagining everyone's looking at you and thinking, "Oh, that's like the goal."
Admission, I did have to conceal a little spot here.
Cannot see a single blemish. Your skin's absolutely glowing. So I think everyone's got a bit of envy at the moment. I did want to talk to you about PPE though, because obviously
Yes.
it is going to become a more normal part of everybody's daily lives now.
Yeah.
And I know a lot of people who have already been wearing them have said that it's been exacerbating their acne around their chins, their jawline, slightly above the mouth. And some people are coining it mask knee. And I was just wondering if you had any advice that therapists can pass on to their clients of how they can kind of manage that, because I think masks are going to be part of daily life for quite a while now, aren't they? So I guess it's just about being able to manage that as best as we can.
Yeah, absolutely. I think primarily the first thing that we always have to appreciate is that it's not your typical acne. So we can't take the typical approach to treating it either. We always have to kind of think outside the box and work backwards as to why the condition's there in the first place. So if it was an existing acne condition that's being exacerbated by the mask, or whether the skin was perfectly clear and then obviously the skin is breaking out because of the mask, it's still fundamentally the mask that's the problem. Now, we can't avoid wearing the mask. Obviously, that's going, as you said, it's going to be a part of the new norm. So we have to wear that. But what we have to appreciate is why the acne is coming there in the first place. So a big part of why people are suffering with maskne is because the friction and the pressure of the mask. Again, it might vary depending on the type of mask that you're wearing. Some people it might be the pressure, some people it might be friction. At the beginning, I mentioned a type of acne called acne mechanica. So mask acne or maskne, because of the friction, is kind of closer to an acne mechanica, i.e., it's caused by friction. To layer of the skin that's causing that skin's barrier to become weak. Therefore losing water and allowing bacteria in. So that's one factor that we need to consider. And then the other factor is the fact that we obviously breathing and our breath is being kept very close to the skin. So that's going to be changing the skin's microflora, the microbiota of the skin, the microbiome. So that is also a factor. So in terms of treatment, as I said, I wouldn't treat it like a typical acne because it's not a typical acne. Keep in mind that the skin's barrier primarily needs to be supported at all times. So I would be including maybe probiotic skincare. to support the microflora. There's a good friend of mine, Marie Reynolds, actually, she's got an amazing probiotic mask. So something like that would be fantastic, and I recommend that to my clients. And then in terms of the friction element, again, the typical types of ingredients that we'd be using for acne would be things like salicylic acid, retinoids, etc. Now, in an acne mechanica or a friction acne where the outer layer of the skin being, friction on the outer layer is the problem, we need to try and strengthen that outer layer as much as possible. So I would be avoiding the typical, benzoyl peroxide, acids, retinoids, not necessarily having to cut them out completely, but definitely pull back on them. Focus more on strengthening the outer layer as much as possible if you can. And also the microbiome as well.
Really great advice. And obviously, I think with acne as well, it can cause a lot of emotional distress for clients, and that's really tough in itself. I mean, how do you address clients who feel uncomfortable in their skin, and how do you kind of help to put them at ease during a consultation?
Yeah, so I think partly, obviously speaking from experience and having acne, knowing how they feel really puts me in an advantage. And I think I know a lot of therapists actually that I speak to, a lot of skin therapists that get into this business, it's because of previous skin issues that they have. So I think if you can come from an approach where you have that empathy for them and can understand that what they're going through, that really helps. And the next point that I would always make is never approach anything from a judgmental perspective. Even if the client in front of you tells you that, they literally just use makeup wipes and nothing else, they're doing what feels right to them or what they know. You should never judge somebody or make them feel bad for caring for their skin in the way that they know. So always, one of the key things that I'm always really kind of adamant about when I'm doing a consultation is I listen. We all have to learn to listen to our clients more. So I take a good 10-15 minutes at the beginning of the consultation where I literally just sit back and I don't say anything other than I'm just listening to them tell me their skin history. Because a lot of the time, especially if they've been to the doctors, one of the biggest complaints that I hear from clients that have been down the GP route is that they don't feel heard. So they'll go to the doctor, they may be in there for a couple of minutes and they're having a prescription written for them. The doctor doesn't have the time like we do to listen to what that client is telling them. So from a client perspective, I think the fact that they can come to somebody like myself and feel heard is a big factor for them. Not always approach things from an educational perspective, never from a judgmental perspective. So, even if a client tells me that they use makeup wipes, I always educate them as to why that isn't necessarily the best thing for their skin, and why something else may be better for them. So, I think that's an important part.
Yeah, I think what you said is so interesting, because actually we had a live with Kate Kerr, the facialist, the other week, and she was talking about rosacea, and she said something very, very similar about GPs treating rosacea clients, and how they don't have the time to kind of talk through it and necessarily build those bonds. But also she spoke a lot about working alongside GPs and really understanding the medications and things like that, because kind of knowledge is power. So it's very interesting that you've said that about acne as well. But they were all the questions I had for you, Andy. There's loads that have come through on the chat, so I'm going to try and go through as many as possible. But if anybody does have any questions for Andy, post them in and we'll do our best to kind of get through them all. So I'm just going to kind of go back to the top to make sure that I don't miss anybody out, because there have been quite a few that have come through. Roisin has asked, how can one prevent post-pill hormonal acne?
Post-pill hormonal acne. So I think, as I said in response to one of the questions earlier, we can't necessarily, we have no control over our endocrine system or our hormones, or at least our sex hormones. We can't control that. One of the things that we can control to a certain degree, though, is our response to stress. So if you've got an increase of androgen hormones and an increase of steroid hormones, the two together are going to obviously exacerbate the condition worse. So if we can control our response to stress, and keep that fight or flight response lowered, then that will have a positive impact. And then so things like mindfulness and meditation and things, for example, that will really help to control our stress levels. And then in terms of topical care, same as how I answered before, that if we can inhibit that 5-alpha reductase conversion from testosterone to dehydrotestosterone, that will help in combination with other ingredients like retinoids, for example.
Brilliant, thanks, Andy. We've got another question. This one's from Beauty by Marina, and they've asked, how long after a spot has settled and there's red left over on the skin can I needle the skin? She's put, I'm Fitzpatrick 2/3.
I mean, it will vary from person to person because everyone has a slightly different healing capacity. I'm not sure if she means, i.e. using a home roller, or whether she means having professional kind of needling treatments. I mean, if I was doing it myself at home, I'd probably start a couple of weeks after the spot was healed. And the same in clinic, really. There's nothing to prevent you from starting too soon.
And we've got a question about vitamin C and acne-prone skin. This person said, I've heard vitamin C can cause breakouts. I'm currently on Roaccutane, but long-term would like to try vitamin C. Could you shed some light on this issue, please? Thanks.
Yeah, so in terms of vitamin C, it's not the ingredient itself that is the problem for the breakouts. It can be the derivative that's being used, the percentage that it's being used in, and the formulation that it's also in as well. So for an example, if we look at vitamin C derivatives, we've got L-ascorbic acid, but we've also got things like sodium ascorbyl phosphate, magnesium ascorbyl phosphate, as well as the lipid soluble vitamin C as well. In an acne protein, something like sodium ascorbyl phosphate is actually really beneficial, and so would L-ascorbic acid to a degree, because it's providing antioxidant support as well as helping the skin to heal post once the blemish is gone. The issue, however, if you're using it in a formulation that is causing irritation on the skin, it's going to promote that acne, but it's the irritation rather than the vitamin C as such, and also the percentage as well. So again, there's a big trend within the skincare industry at the minute that more is better, when actually if we look at a lot of the studies for vitamin C, even at 10%, it's an effective level of ingredient to use. So do we really need to be using 20%, 25%? And that's where I think that's where the problem starts. It's not the ingredient as such. That's a too simplified way of looking at things. It's the type and how it's used.
Yeah. And I Get Anna Beauty Works is asking about microneedling for acne clients. They've asked, how often can you do microneedling? Can you use it together with other products or on its own? And are there any contraindications or precautions to be aware of?
Yeah, so there was 3 questions there. So
sorry, all in one. So we'll start with how often. Sorry, just put that all on you. How often can you sort of do microneedling on an acne client?
Yeah, how often will depend on the depth of the needle that's being used. So, for example, 0.5 you could do maybe once every 2 weeks. Whereas if you were using a deeper needle, then you would space at least kind of 4 to 6 weeks apart. Although if you're going deeper than a 0.5, it's probably because you're trying to treat scarring, not the active acne. Yeah. And then, sorry, what was the other part of the question?
The next part was about, can you use microneedling together with other products or services, or is it best to use it on its own, I think is what she's asking.
Yeah, again, it will vary depending on the depth of the needle that's being used, and the condition that it's being used in. So, for example, if I'm doing a skin pen treatment for post acne scarring, I will only ever use the skin pen precision with no actives at all. There is a big argument within the kind of field. Some people are very pro using ingredients, and then others are anti. What I would say to that is you've always got to ask the question why that you're using the microneedling in the first place. And is that ingredient that you're going to use actually support the treatment, or is it going to hinder the treatment? And also, when does the skin need that ingredient? Because if you're needling deeper than a 0.5, if there's an inflammatory reaction, the skin wouldn't start regenerating collagen at that point until day 1 or 2 post treatment. So it doesn't necessarily need actives like vitamin C and things being added into it at that point, and whether the skin would actually utilize them or not. So, but in terms of more shallow needling, I do a lot of kind of what I would class as epidermal needling in treatment. So with that, the whole aim of that is to get more ingredient into the skin. So if it's a 0.25, 0.3 that I'm doing, then I'll be combining ingredients. Even down to a 0.5 I will, but anything beyond a 0.5 I don't believe in using ingredient with microneedling.
The last part of this question was just about, are there kind of any contraindications or any precautions that therapists should be aware of before doing microneedling on an acne client?
Yeah, so if it's an active acne, if the signs of if it's active pustular acne, then I would avoid that. Now it would depend on whether, if we're talking just like one active pustule, then of course we can treat the rest of the face and just work around that pustule. If it's widespread though, I treat it with LED and peels, maybe to get that under control first before considering microneedling. If it's a non-inflammatory, non-pustular acne, so i.e. grades 1 or 2, then by all means, microneedling is amazing for treating those lower grades of acne. So we can do that.
Yeah, it's a treatment that has great results, doesn't it? Tessa Stevens Beauty has asked, why do some people that have very high stress levels and poor diet don't even get one spot or any grade of acne, yet others are very affected by stress? It's a good question.
Good question, and I wish I knew the answer. I'd make a lot of money.
No. It's a very good question. I don't know if you've got any thoughts on that, Andy, but
I think there's probably genetic factors involved there. There's also a field of science called epigenetics, so maybe that's which is kind of things that on top of our genetics that play a role in which genes are expressed or not. That might be a factor. But yeah, I completely understand there are some people that seem to be able to eat what they like and never get affected. It's not fair.
I know, we wish we all knew the answer to that one. Just for some people who have asked about, is this going to be available to watch afterwards? It is. We are going to put this, it'll be available on PB's Instagram grid straight after this. And also we'll put it on our YouTube channel as well. So you can definitely come back. Everybody who said their internet's cut out and they come back, you will be able to rewatch it and get all of Andy's great info. Another question we've had is from Internal Ways, and they've asked, what product would you recommend which has salicylic acid in for acne? Like, is there any that you would, you've used and you think are great?
Yeah, Cosmetics, which is one of the brands that I use in clinic. They've got a fantastic salicylic based serum called Clarity Serum. They've also got a face wash which is called Clarify, that's got salicylic and also probiotics in there as well, so that's a really good product. One thing that I would be cautious though with salicylic, and again it kind of goes back to what I was saying about how consultation skin assessment for. Oh, I lost you. Oh, back. Yeah, and skin analysis are really important because you know occasionally, well, quite frequently, clients will say to me, "Oh, I've been using salicylic and it's making my acne worse. It's not making it better." And that's because salicylic is great for those types of acne where I would class them as those typical sort of adolescent or like oily type acnes, like oil dominant acnes. But if in certain types of acne, like your hormonally mediated acne or your drier acnes, salicylic can actually make it worse. So I think this is where people need to be careful with ingredients that are supposedly typical acne ingredients, because in certain cases they can actually make it worse.
Yeah, it's all about the consultation, isn't it, really, with the client?
And skin analysis as well. I think for any therapist watching who doesn't already use a Wood's lamp in treatment for their skin analysis, definitely best. The amount of surprising situations I've been in where I would look at a client thinking that they were lipid dry and they've actually presented with lots of oil under the Wood's lamp, and vice versa, you know. So it's a really fundamental tool that kind of helps, you know, ensure that you're on the right path in terms of treatment plan and home care and things. So
definitely. We have another person, their handle's DMLM6, and they've said, I think my skin barrier is very compromised around the chin area, very tight and flaky. What would you recommend for this?
So diet-wise, I would look at ensuring that you're getting enough omegas 6 and 3 in the diet. As I said, when in terms of skin barrier, omega 6 in particular is important for ceramide production within the skin. And the skin cells on the surface of our skin, i.e. the cells that make up the skin's barrier, are only as healthy as the cell at the base of the epidermis. So it doesn't matter what we put on the top, if we're not supporting those cells at the beginning, they won't be healthy when they get to the top. The other thing I would look at is, are you getting enough calcium in your diet? Because calcium is a really important part of the metabolism of a protein called filaggrin. So from profilaggrin to filaggrin into natural moisturizing factor. Again, it helps to make the skin's barrier that kind of nice waterproof seal. So have a look at that in your diet. And then in terms of topical care, cleanser is normally the #1 culprit for making a skin's lipid barrier compromised. People have this psychological association with cleansing their skin, especially if they're acne, that their skin has to be squeaky clean. And as soon as a client tells me, oh, I like this cleanser because it makes my skin feel clean, as soon as they feel anything, it tells me that they've made this psychological association with their skin feeling kind of like stripped. So look at your cleanser first and foremost, and then look at things topically as to support the skin's barrier, things like ceramides, cholesterols, free fatty acids, you know, things like beta-glucan, D-panthenol, linoleic acid, linoleic acid as well topically. These all help to strengthen the skin's barrier from the outside in, but support internally as well.
Great. We've had a question from TM Pancakes. What a great handle. And they've said, I heard that microneedling can puncture pores that have blackheads. Then that needle is now contaminated and will enter other pores, which could then lead to more spots. Is that true?
No, that's a myth.
Yeah. So that's good. And then a question from Gillian has asked, how long do you wait to ensure the acne is not active before you do the professional needling?
So this is where, for me, Wood's lamp analysis is really important, because with the Wood's lamp you can assess whether there's any active infection there or not. If you're not using any sort of diagnostic equipment, you're kind of working blind to a degree. But I think you know, it's a common sense approach. If you can see pustulas still on the skin, then just wait that little bit longer. And, yeah.
And a couple of people have asked whether you use laser treatments at your clinic to treat acne.
I don't use the typical laser, as in when a lot of people use or refer to laser, they'll be referring to things like Fraxel and laser resurfacing. It's not something that I've ever been that interested in, to be honest. I've always approached things from a skin health perspective, and I practice something called corneotherapy, which is about supporting the skin's outer layer as much as possible. Thermal energy, high energy lasers like Fraxel, etc., they obviously have more of a risk involved, and a big proportion of my clients, almost 50% of my clients, are skin of colour, so Asian and Black community. So and every treatment that I have in clinic, I've always ensured that it's suitable for all of my clients, not just a subset of my clients. So I've never gone down that route of Fraxel. However, I did beforehand, just before lockdown, a week before lockdown, get in something called the Bionic, which is a cold laser. So there's no heat energy involved. It's actually the energy, same temperature as our body, so it's classed as a cold laser. And it has a regenerative effect. It has antibacterial effects, so you can treat active acne, and it's suitable for all skin types. So you can treat the acne and also like scarring, but it doesn't do it by inducing a wound in the same way as what something like Fraxel would. So it's so yes, I do use laser, but not the typical type of laser that they probably refer to.
And a couple of people have been asking about what wood lamps that you use, if there's anything that you would recommend on that side of things as well.
I bought mine years ago from a company called Cosmotronic, and I've got a feeling that they no longer exist. So yeah, I'd have a look on the internet. I honestly don't know. I'm dreading the day that it breaks, because I know I've then got to look for another one. My first woods lamp was off eBay and it was rubbish. It wasn't fit for purpose. So yeah, just have a look online, find a reputable provider.
And we've had another question about, do you have any advice on how to treat an aging skin with acne breakouts that is also beginning to show signs of rosacea? I suspect that in one of my clients currently at the moment.
Yeah, so you've got to prioritise the condition. Don't try to treat everything from day one. I tend to work a lot in phases with my clients, so I'll prioritise the condition. You know, in this case, if that was my client, I'd be treating the acne. Well, I'd be treating the skin barrier first and foremost. That's where I would start. Aging side of it would be kind of later on down, once I've kind of got the acne and the rosacea under control. But yeah, that sounds like a very complex case. It may be that they need to refer to their doctor as well.
And we had another question as well, more a general one, about what essential actives do you think should be in everybody's skincare routine? Like, what are your absolute musts?
Sunscreen, first and foremost. And this is another product that actually a lot of acne sufferers will shy away from, because they think it's going to break them out. But actually, if we're not protecting our skin from the sun, from UV damage, the free radical damage and lipid peroxidation that as a result of UV exposure will make the acne worse, and it will make the skin like weaker and therefore make the acne worse. So sunscreen first and foremost, a good gentle non-stripping cleanser, and then everything else in between will really vary depending on the type of acne in the client. As I said, I'm not a big fan of blanket statements. So things like salicylic acid, for example, a lot of people will say, oh, treat spots with salicylic acid. But as I said at the beginning, it's like if the underlying skin condition is a dry acne, that salicylic is going to make it worse. So I think this is where diagnostic assessment is really important.
Absolutely, yeah.
Try and avoid retinoids, though, would be one. So, you know, retinol, I'm a big fan of retinaldehyde. regardless of the type of acne, that would be a good one. And maybe those group of 5 alpha reductase ingredients that I mentioned earlier as well.
And with retinols as well, with acne prone skin, is there a certain percentage that clients should be starting on? And, you know, is there a limit on what percentage you can take them up to with retinol? Because obviously it's quite potent, it's very strong, and obviously it's like kind of the wonder ingredient, isn't it, for skincare? But do you have to be a little bit more cautious with it with these types of clients?
Again, it will vary based on the client, whether how much oil is present in the skin, the age of the skin. I generally, as a rule of advice, though, I generally start people on the lower strength. So, for example, if I was putting somebody on a retinol, probably be 0.25%. For a retinaldehyde, it would be 0.05%, and then kind of build up from there. Obviously, dryness and flaking is something that can happen with a retinoid, but in my opinion, it's something that should be avoided if possible. It should never be the aim. Some people seem to think it's the goal, when actually it's an unwanted side effect. If you over dry the skin, the acne can get worse. So I think that should be avoided. But in terms of moving up through the percentages and how far you can take somebody, it will completely depend on their tolerance and how much they need. You know, if we can clear somebody's acne and get it under control with a 0.05 retinaldehyde, then they don't necessarily have to carry on moving up. It's not, you know, it's not a race.
Definitely. We've had another question as well about asking if there is a particular product you would recommend for people who have the tiny bumps kind of acne. Whether there's a particular AHA or anything like that that would be particularly good for that.
So I'm presuming they're talking about like closed comedones.
I think so. That's how I sort of read it.
Because sometimes there is, I don't know whether you've noticed as well, but there's a lot of talk about a fungal acne at the moment as well, which could present itself like bumps under the skin, and that's more of it's a fungal type malassezia. So that would slightly be a little bit different, but it can sometimes look like closed comedones. So I'd say, again, it kind of depends on the skin, really. As I said at the beginning, acne fundamentally is a skin barrier disorder. So if we're overzealous with exfoliation and acids in the aim of trying to clear that, you know, that comedone out, we could actually end up making the condition worse. We have to track back to why it was there in the first place. So I refer to something called interfollicular corneocyte compaction, which is a bit of a mouthful, but it's like our outer layer, so the corneocytes that we see on the surface of the skin don't just reside on the surface, they actually go sort of inside the follicle. So if those cells are not shedding correctly, that's where the plug comes from, that's where the comedone comes from. And part of what's happening, or why that may happen, is if the skin's protective layer, so the skin's lipid barrier is compromised and it's allowing too much water to escape, the enzymes that are involved, the protease enzymes that are involved in allowing those skin cells to shed off singularly, those enzymes are impaired. So we get a grouping or a clumping of cells. And again, if that happens inside the follicle, then we're going to get like a compaction, a plug happening. And that's why sometimes if it's happening on the outer layer of the skin, you'll sometimes hear acne clients saying, well, my skin's really oily, but then it's really dry because I can see flakes on the face. But it's not dryness, because we know that the skin's producing enough sebum. So your skin's either oily or it's lipid dry. But actually that flake that is happening is what we refer to as impaired enzyme activity. So the enzymes don't have enough water. And the reason they don't have enough water is because you've overstripped the skin in the first place. So if we exfoliate that skin to try and get the impaction out, we're just compounding the problem. So take a step back, focus on repairing the skin's barrier, supporting the hydration levels from within the epidermis. And then my first point of call would be either an enzyme treatment, because enzymes work in the same way as our own natural enzymes. So they're a little bit more respectful of the epidermis. They'll break down the proteins, but without disrupting the lipids underneath. Or a really low strength lactic. I'm a big fan of, out of all of the AHAs, I'm always a big fan of lactic acid, because it's more hydrating, it's more humectant than, say, things like glycolic. And it also increases ceramide production as well. So we increase ceramide production by about 50%. That would be a good option. And then again, going back to fats in the diet, look at fats in the diet. If you haven't got enough omega-3 in the diet, the quality of the sebum that's coming up through the follicle is going to be more viscous, it's going to be more sticky. If you haven't got enough omega-6, you haven't got enough ceramide production going on either. So it's not as simple as not a simple answer.
It's so complex, isn't it? This is so
interesting.
It's like,
that's why I get so fascinated by skin.
Yeah.
The more I love the organ, but yeah.
And we're just getting inundated with questions. So I'm going to try and do a little bit more, Andy, just before we let you go. Alfie Skin has just said, tretinoin, 3 months on, 3 months off a year. They put, Andy, I know you're not the fondest of tret. However, do you think sometimes it can be necessary?
It's not that I'm not fond of tret at all. That's not, if I've given that opinion at any point, that's not necessarily the case. What I'm against is the overuse of anything. So if, for example, I will, occasionally come across people who have never even used a 0.1 retinol, 0.25 retinol before, and then all of a sudden they're jumping in with tretinoin, and they're wondering why their skin's getting really flaky and it's irritated, and so it's that I'm more against. It's not the tretinoin that I'm against, it's just the overuse of anything. So if your skin is perfectly responding well on tretinoin on this 3 month on, 3 month off cycle, then by all means carry on using it. That is not an issue. I mean, fundamentally, every retinoid we apply onto the skin, retinol, retinaldehyde, converts to tretinoin. So I love retinol and retinaldehyde. I can't be against tretinoin. It's just, it would be contradictory, but it's just the overuse or over pushing of the skin that I'm against. Because fundamentally, if you dry the skin out, you're disrupting that skin's lipid barrier, and that's when the skin starts to become unhealthy. But if your skin can tolerate it and you're seeing good results, then by all means you carry on.
Yeah, it's a delicate balance, isn't it, really?
Absolutely.
We've had quite a few questions, actually. They've come in a few different kind of forms, but about treating clients that have both eczema and acne and how you would go about that.
So again, it's a barrier disorder. So sometimes I'll get clients who have eczema on the body and then they get eczema on the face. At other times, if people are getting acne on the face, I will ask if they ever get things like keratosis pilaris on the back of their arms. All of these for me are clues as to how well their skin's barrier is forming. They may be low in calcium in their diet, they may be low in essential fatty acids in their diet. If it's eczema, however, if it's a true eczema, that's relating to our innate immune system. So, but again, you can maybe have things like eczema happening on the body, and like lower grade, like non-inflammatory acne happening on the face, because even though you'd think they're polar opposites, like one's a very dry skin condition, one's a very an oilier skin condition, it's the way that skin's lipid barrier and stratum corneum and the microbiome, it's how it's all working together, or not working in this case. Did that answer the question?
Yeah. Honestly, people are absolutely loving your answers. They're calling you a superhero and everything. It's so sweet.
I can't see questions. I don't know what's going
I've
on.
just been told by Instagram, I've got the 1 minute 53 seconds remaining timer coming on, which says we're going to hit our max. So I'm afraid that's all we have time for with Andy today. I know a few people have sort of come in a bit later and they've asked if they can view this again. This will be on PB's Instagram grid pretty much within the next few minutes, and it will also be going on our YouTube channel. So if you have missed anything, you can go back and watch it all again. But Andy, I just want to say an absolute massive thank you. This has been so informative. People have been really enjoying it. We've had an absolute outpouring of love, and I think it has been really, really educational. So thank you so much for giving us the time, and thank you for everybody who's joined the talk today. Really appreciate it, and we hope to see you on some more of our webinars and our lives. But otherwise, I'll say thank you so much, Andy. Have a lovely weekend, and thank you everybody else.
All right,
And I'll
take
see you
care.
guys soon. Thank you so
Bye.
much.
Bye.
See you later. Bye.